good line. So stay still with the needle and find it with your probe. Find the needle with your probe. Try and bring it a little bit forward. So there's your needle. So see with the needle tip? The needle tip's a little steep, right? So here's the needle coming in. Here's the needle tip. This is my goal space over here. So come back just a little bit and flatten off. So see the needle tip?
Yeah.
Get out of that fascial plane.
Back more.
Yeah. You feel it get out of that fascial plane?
Yep.
Now run a little flatter on that line right there. Good. Run on that line. Run on that line. Run on that line. You're right on it. Right
Perfect.
Right there?
there. Yep.
Alice, how do you feel?
Yep. Right on top of it. Ninja.
That's it. That's the
You're
spot.
like, that's the spot, and you're watching it right there. Filling up.
You feel the intense pressure right there in your spot.
That's usually where it goes. Yep. Perfect.
Now, this is not your normal. It's going to be hard push.
I was like, yeah,
It's
it's.
going to be hard push. Once again, we're through a 4-inch 22 gauge needle, right? So pushing through a 4-inch 22 gauge needle is going to be difficult. And then there it was. You opened up the space a little bit. Yeah, you're great. That should flow nice and pretty now.
Yeah, it is.
So you finally broke it open.
Yeah,
So she was stuck on probably a little calcification, a little bit of thickened spot, and we
Maybe
got
pull
through
back
it.
just a smidge.
We're all right. We're in a great spot right there.
You can view the needle and everything.
And then whenever you're ready, go ahead and come all the way out.
So technically you would call that what?
That was a rectus femoris direct head injection off the AIIS, anterior inferior iliac spine.